My name is Annie.
Hi, Amy.
How are you?
Good, thanks. How
I'm
are you?
registered nurse, the hemodialysis nurse for you today.
Mhm.
Okay, may I know your name, please?
My name is Kim Jones.
Okay, and your date of birth, please?
My date of birth is 4 July 1998.
Okay, would you mind if I'm set?
Yeah.
Okay.
Or did I say 98?
Yes.
Oh, it's 86.
Okay, okay.
I'm sorry.
It's okay. So before we start today's session, so I just want to let you know,
Mhm.
I'll asking some of the questions regarding to your health and your fistula.
Mhm.
If you feel like I'm going too fast and if you don't understand anything, you can interrupt me right away.
Okay.
We'll go through again.
Yeah.
So first of all, I'm just gonna ask you: is it okay if you're sitting in a comfortable position like
Oh,
that?
yeah.
Okay. So how are you feeling today?
Good, little thirsty.
A little thirsty?
I
Yeah,
brought my
saw
two
it.
glasses.
Oh yeah, right.
Yeah.
So you feel thirsty all the time. You keep on drinking.
Yes. Yes.
I assume your nephrologist asked you to restrict your fluid, right?
Yeah, I know. I cheat sometime.
Okay, okay.
Mhm.
But you know it's not good for your body as your kidneys are not functioning,
I know.
right?
I know.
Okay. So we're gonna start with the weight.
Mhm.
We'll get your weight done.
Mhm.
Then I'm gonna check your vitals.
Mhm.
Okay, so we'll go through there. Okay.
Yeah.
You can just come and have a stand on this machine. So your weight is 84 kilograms.
Oh, I'm
Is-
heavy.
Oh. Okay. But your doctor gave me the estimated weight, the dry weight, the target weight I would say.
Okay.
It's 80 kilograms.
Okay.
So like that's the target that's what we're gonna achieve. Okay, so now I'm gonna check your vital signs. Okay. And I'm just gonna clean my hands, that's important. Okay, so I'm gonna put this cuff on your arm.
Mhm.
As you have the fresh on that arm, so I'm not gonna check on that arm. Okay. Okay, while I'm checking that, I'm gonna put this on as well.
Mhm.
Oh, your blood pressure is 187/98.
Oh. Okay.
Pretty high.
Okay.
And your pulse is 105, and
Okay.
that's pretty high as well.
Okay.
So I check your respiration while I was checking your blood pressure. So it's 26. And I'm gonna check your temperature.
But I'm taking.
Sorry,
my,
you were saying, yeah, sorry, you were saying something.
Yeah, I was taking my pills too for hypertension.
Oh, is there any changes occur in last days or last week?
They decreased, but I don't know which one.
Okay, okay. I'll go through the medication with the nephrologist and I'll figure it out which one, okay?
Okay.
I'm gonna check your temperature before I forget. Oh, it's 36.8.
Okay.
It's pretty good.
Okay.
Okay. And I checked your weight and vitals, so that's pretty good. So now you said you forgot like which medication changes occur, right?
No.
No, okay. So
I sometimes have a shortness of breath as well.
okay. So is it like when you're walking or some stuff like that?
Yeah, like
Okay.
if I rush.
Yeah, okay. Do you
Yeah.
take any puffers for that?
No.
No. Okay. You just catch your breath after.
No. Yeah. Sorry.
You do? Okay.
Yeah.
Okay. So I'm just reading your diagnosis. Let's say you're diabetic.
Yes, I am.
Okay. So are you taking any insulin for that or any other medications? No. So you're controlling.
Yeah.
So are you writing any notes like
Yes,
recording?
I actually brought you some notes. Here
Okay.
Because last time my nurse asked me to keep the track of this.
Okay.
So yeah.
Okay, so you're checking your blood sugars, your blood pressure,
Yes.
and everything at home.
Yes.
That's pretty nice of you.
Yeah.
Okay, so next, what I'm gonna do, I'm gonna assess you fistula site. Okay.
I forgot to
Oh,
mention
yeah.
my legs are a little puffy.
Oh, okay.
Yeah.
So can I have a look?
Yeah.
Okay, I'm gonna clean my hands again. Okay.
Ah.
Does it hurt when I?
No.
Oh, okay. Yeah, it looks puffy, like it's edema, so which means like the fluid is in your legs. Okay, so which is directly showing your kidneys are not working well, right?
Yeah.
So I forget to check your lungs and heart sound.
Yeah.
Okay, can I
Yeah.
check that?
Oh yeah.
Breathe in and out. In and out. In and out. In get it out. Okay, so when I'm listening to your lung sound, I'm listening like a little bit of crackles and wheezes.
Okay.
So which is directly showing me the fluid overload in your heart and lungs as well. Okay, so I'm gonna consult with your nephrologist for that as well, and with your blood pressure as well, and the hypertensive medication.
Sure.
Right? So I'm gonna go to your fistula now. Okay, so I'm cleaning my hands again for sure.
Okay.
Okay, so first I'm gonna look at your fistula side. Don't feel that I'm staring at your arm. Okay?
No.
Yeah. So I'm looking for any redness, any swelling, any bruises, any bleeding, any pus. So this looks clean to me, which means it's healthy. So next I'm gonna check like the blood flow. Okay, so I'm gonna just lift up your arm above the heart level. So okay, so this is collapsing, which means it's not coming up. So which means it's pretty healthy and the blood flow is going okay. Okay, so next I'm gonna check a capillary fill in your hand as well. So which means I'm checking the blood flow, if it's okay, if the fistula is not interrupting any blood flow in your arms and hand. Okay, so this is okay, like the blood is coming back to your hands and fingers, so which is pretty good.
Okay.
If it's not coming like in half minute or maybe taking longer than half minute, so which means there is something wrong with it. Okay. So next I'm gonna do listen, because I'm doing look, listen, and feel. So I'm listening the breath. Okay. So that's like a swooshing sound. Okay. So I'll listen. Okay. With my stethoscope over your fistula. So I'm listening the swooshing sound, which is normal. Okay, so I'm gonna listen to, I'm gonna feel the thrill.
Okay.
So thrill means like a vibration sound, like a vibrator. So I would say like a vibration sound in your fistula. So if it's...
Yeah, last time when nurse told me it's like a bee buzzing
Oh
sound.
yeah, like a buzzing sound as well, okay?
Yeah.
So I'm gonna feel that with my my stethoscope as well, okay?
Okay.
Yeah, so I'm listening that, so it's pretty good. So last I'm gonna feel the pulse on your fistula, okay? So it should be normal, like it should be normal as our heart, okay? So it's pretty good, like it's not pulsating, it's not rushing anything, so which means it's pretty good. So I'm gonna feel the temperatures on both of your arms, like it should be same, okay? That's pretty good. And I'm looking, your both arms look same, so which means it's pretty good. Any fall occurs?
No.
Nothing, any changes occurs? No. So how long you had the fistula for?
It's been a month.
Okay, any trouble with needling?
No.
Any trouble in bleeding?
No.
No. Any bleeding in your urine, your stool,
No.
in your gums?
No.
None? No. So everything is good, right?
I was just worried about this scar.
So the scar is okay. So there is nothing to worry about that. It depends on the site. So like where is it? So it should be like if it's at the wrist or if it's at the arm. So where is it? It should be like because of the stitches they made the fistula for. Okay. And quickly I'm gonna go over to your whatever the treatment plan is. So you're taking Ravamax 400 dialyzer, and your dry weight is 80 kilograms, the target weight, and you're taking 3K 1.25 calcium dialysate baths, and 3 hours 3 times a week you're coming. Okay, so your sodium is 140, your dialysate flow is 500, temperature 36, and we are directly connecting. We're not giving you any saline, which means heparin is 2500 and 1000 units. I'm stopping it. Like if it's gonna go for 3 hours or maybe 4 hours, so I'm gonna stop like an hour ago. So that's gonna decrease the bleeding risk. And we are using the fistula and the blood flow as you're tolerating. Okay. So when I'm reading this, so the URR, which means like the urea reduction ratio, it's showing 55 to 60% in your book, like in your records. So which is like, I'm not saying it's really low, but it's like little bit on the lower side. So usually as you're coming like 3 days a week, so it should be like near about 65,
Okay.
but it's showing like 55 to 60%. So I'm not saying it's not working okay, but still I'm gonna consult with your nephrologist as well.
Yeah.
Okay, and whatever I have the information from you till now, so I've calculated like the target. So which means like how much food I'm gonna take up from your body. So last time I saw it's like they took 2.5 liters. So today, whatever I have information, so I calculated it's 3 liters. So, but still I have to consult your doctor.
Okay.
So I'm gonna just quickly let you know, like whatever. So how I'm calculating it. So I'm taking your today's weight, that was 84 kilograms. Then I took your weight, like the target weight was 80 kilograms, and the priming of the tube when we are connecting it. So it was like whatever we are using the priming and the medications and your 2 glasses of water, and the last thing is any saline we are giving to you. Okay? So whatever I have the information, so I'm gonna just call your doctor quickly and I'll ask him what to do. Okay? So I'll be back. Is that okay with you?
Oh yeah.
Yeah, you can just enjoy your time. Okay? So I'll be back quickly. Hi doctor, this is nurse Annie Blake from nephrology unit. So this is about one of my resident. So can you please give me a call back? Her name is Kim. So actually one of the medication got decreased for the antihypertensive, but she forgot like which one, and her legs are really puffy today as well, and her URR is 55 to 60%. That's what I'm concerned about as well. And her target, what I've calculated, is 3 liters. So I just want to have a concern from you as well. Is that okay if I go with whatever the prescription we had the last time, or do you want me to make any changes this time? So if you can please give me a call back, that'll be really nice. This is Annie again, and from the nephrology unit. Thank you. I'll be waiting for your call. Thanks. Hi, sorry, doctor didn't pick up the call.
Oh, that's fine. I'll wait.
Thank you.
No rush for
So
that.
as we are waiting for the doctor, we can just go for the treatment plan quickly. Okay, is that okay with you if I just give you a little?
Yeah, that'll help.
That'll help. Okay, so first I just wanna really encourage you, keep track on your medications. Okay, so whatever you're taking, just keep a track. Whatever is decreasing or increasing, that'll help for you and for us as well.
But I like my KFC.
So for your food, okay, so for your diet plan, so you shouldn't be taking, like, I'm not ordering you, but I'm just really encouraging you, just take the food low in sodium, potassium and phosphorus. So the food, like the canned food, the fried food, the sauces, and like the salad dressing, the beans, nuts, so they are high in the sodium, potassium and phosphorus, because the kidneys are already, like, the function is already decreasing, and the kidneys is like they are not taking out anything. So I really encourage you, so just take the foods which are, I'm not saying to stop everything, just take like the food which is lower in sodium. Just look at the content, how much it contains, okay? And keep a track on your intake and output, how much you're drinking, whatever you're drinking, just keep a track on that, and how many times you're going to the bathroom. That'll help as well. Okay, and the last thing I just want to see, do you have any help at home? No. Do you want some help?
Sure.
Okay, so I will.
Doesn't cost me so much money, right?
No, for sure. We'll go sit with the social worker. We'll discuss with that. We'll discuss about the finances. We'll go through there. So like, I'll introduce you to the social worker, and then we'll go from there. Like whatever the social worker will say. Okay, and any treatment changes, just keep an eye on that as well. And anything else you?
No, I think that.
Yeah, I just mean the diet and your medications and your intake and output for your food. That'll help for sure. I'll give you a pamphlet for sure.
Yeah.
So that'll just
that's great.
have an idea about what food you can take.
Yeah.
Okay, and any help with the cooking or anything, so we'll consult with the social worker so they can arrange something help for you.
Oh, that's great help.
Right?
Thank you.
Okay, so anything else before I just go and finish up the work before we start with hemodialysis?
No, you explained pretty well. I liked it.
Yeah,
That
nice
was a
to
great
meet you.
Nice to meet you too.
Sure, I'll just call your doctor again and we'll catch on the doctor and we'll go for your hemodialysis treatment for today.
Okay.
Okay?
Thank you.
Yeah.
I'll be waiting for you.
Sure, don't cheat on the water.
No, I won't.
Okay, bye.